A new generation of anti-obesity medications are recently approved by the FDA, and these medications are anticipated to be a mainstay of future obesity care. However, anti-obesity medications are highly underutilized. To better understand this underutilization, the Observe study conducted an online survey among people with obesity and healthcare providers in the U.S. The survey examined perceptions of obesity, obesity treatment, and potential drivers and barriers to the use of anti-obesity medications. At the time of the survey, only 4% of people with obesity were treated with an anti-obesity medication, while more than half were unaware of any FDA-approved medication for weight reduction. The study found that both groups considered that individuals with obesity are primarily responsible for managing their disease. Despite the shared perception that the individual is primarily responsible for their disease, most people with obesity felt their healthcare provider's advice would be helpful, while only half of healthcare providers felt that their patients with obesity wanted medical advice for obesity. These findings and others support potential discord in the patient-provider relationship in obesity care. Most participants in both groups envisioned only a short-term role for anti-obesity medications in obesity treatment, despite the evidence obesity is a chronic disease. Counter to this view, other responses suggested the possible opportunity for the two groups to align on the role of long-term medication utilization. This was seen when considering a potential new approved anti-obesity medication. About half of the people with obesity expressed a willingness to use long-term, and most healthcare providers predicted that their patients would do so if initial weight reduction was satisfactory. Costs and insurance coverage of such medications were leading barriers to adoption for both groups. Both groups had high levels of concern for potential long-term side effects with newly approved anti-obesity medication. The authors conclude that effective educational efforts to address obesity as a chronic disease and to communicate evolving data on long-term outcomes and the safety of the latest generation of anti-obesity medications could facilitate more widespread implementation of evidence-based obesity care and foster shared decision-making.